Do you or your partner suffer from erectile dysfunction? Is erectile dysfunction affecting your sex life? If so, stay tuned as we'll be talking about the most common causes of erectile dysfunction and how to treat it. Welcome to JHP Medical, I'm Dr. Hart Pinto and I'm going to tell you all about erectile dysfunction and how to treat it. If you like this video, remember to subscribe and click the notification bell so you don't miss out on any of our latest videos. So what is erectile dysfunction? Erectile dysfunction, also known as impotence, is the inability to obtain an erection and sustain it for long enough to engage in sexual intercourse. Erectile dysfunction is a very common condition amongst men, particularly once you reach the age of 40. In most cases, the episodes are caused by stress, anxiety, lack of sleep, or excessive alcohol intake. For some men, these can be a single episode which can self-resolve and are often nothing to worry about. However, if you find that you or your partner are regularly suffering from erectile dysfunction, this may indicate a more concerning medical or psychological problem. In some cases, erectile dysfunction may also be associated with other medications you may be prescribed. So how will my doctor find the cause of my erectile dysfunction? During your consultation, your doctor will take a detailed history regarding your erectile dysfunction symptoms. A number of factors can also increase your risk for the development of erectile dysfunction, and each factor may need to be addressed individually. Lifestyle factors, which includes being overweight, or having a history of smoking, excessive alcohol intake, or illicit drug use. Your doctor will also want to review your mental health. They'll look at your anxiety and your stress, which can dramatically influence your ability to get and sustain an erection. For some patients, having a hormonal imbalance can play a role, such as having a low level of testosterone or suffering from diabetes. Some prescribed medications can also cause erectile dysfunction, such as antidepressants and some antipsychotic medication, certain blood pressure medications, and testosterone blocking medications which are commonly used for prostate issues. If you have a history of cardiovascular disease, this may also indicate that the blood vessels supplying the penis are also affected. If you've had a history of injury or surgery to the genital area, or any conditions which may affect the nerves supplying the penis. Your doctor will also need to examine you and your genitals. You'll need to be assessed for signs of hormonal imbalances, nerve problems, along with measurements of your blood pressure and heart rate to assess your cardiovascular health. Will I need any investigations? Well, your doctor, depending on the presentation and findings from your examination, may consider performing some blood tests. These tests may help identify hormonal imbalances such as low testosterone levels, or even help to identify other conditions contributing to your erectile dysfunction, such as diabetes. So what treatment is available for erectile dysfunction? Okay, your doctor has diagnosed you with erectile dysfunction. What can be done to help? Thankfully, treatments for the management of erectile dysfunction are effective in the vast majority of patients. However, it is important to recognise that the management of each patient's erectile dysfunction is likely to be different and will be dependent on the individual cause. Where stress and anxiety are the precipitating cause, you may benefit from psychosexual therapy. Here you'll be given the correct tools to manage your anxiety and stress levels, which in turn should improve your mental well-being, but also the symptoms of erectile dysfunction. Your doctor, if relevant for you, will discuss the importance of improving lifestyle factors, such as reducing alcohol intake, stopping smoking, and avoiding drug misuse. Keeping your weight at a healthy level can also be beneficial, and either a dietitian or your own doctor can help you with this. Where a medical cause can be identified, your doctor will advise you on the required steps to manage these conditions. For example, the use of medications to control your blood pressure and cholesterol to improve your cardiovascular health, which in turn improves your symptoms of erectile dysfunction. So what about medications? You've probably heard of Viagra, also known as sildenafil, perhaps one of the most famous medications to treat erectile dysfunction. This is a medication that's available on prescription from your doctor or via your local pharmacy. These medications are taken prior to intercourse and are effective in around 3/4 of patients. However, we would advise against purchasing this medication online as there are many websites selling counterfeit products. Can I use a vacuum pump? Vacuum pumps work by sucking blood into the penis, and they may be an option for a patient who've not had great success with the medications. However, it can be a little bit traumatic and can cause a little bit of bruising. Are there any surgical options? Surgical options, of course, do exist in the form of penile implants. However, they come with surgery and their own risks. This option usually is reserved for those patients where other treatments have failed. If this is something that you wish to pursue and you've tried all the other options, you should discuss this with your regular doctor. They'll probably suggest a referral to a specialist at that point. Thank you for watching. We hope you have found this information useful. If you've enjoyed this video, why not subscribe, click the bell or write down below. Of course, this video does not provide any individual medical advice and is intended for informational purposes only. Do not consider this as a substitute for professional medical advice, diagnosis or treatment. Please don't ignore professional medical advice in seeking treatment because of something you've heard here. If you believe you may have a medical emergency, immediately call your doctor or ambulance service. Thanks for watching. See you next time.